This is my video for a diagnostic ultrasound of quadriceps tendon and meniscus. So for the knee anatomy, the picture on the left shows a good view of the quadriceps tendon, how you'll see your patients with all the quad muscles at the top and then your patella right there in front of you. The picture on the right shows a good lateral view of your knee, showing your femur coming down with your muscles surrounding it, and then where you should have that joint line and have your meniscus sitting on top of your tibia. For your patient positioning for quad tendon, patient should be supine with knee flexed about 20 to 30 degrees, and you should place a bolster under your patient's knee just for comfort. So right here is showing your long axis and transverse views of how you would place the probe on your patient. So you should just palpate for the patella and then just go superior to that. You should be able to feel your quad tendon in there. So the structures you're looking at on these views are your femur, which should be your deepest reflective structure. Patella should also be reflective. And then if you're looking at it from a long axis view, it should be on the one side of your screen. And then quad tendon will be your hyperechoic structure, kind of closer to the skin. So this is your view from the longitudinal image. It is, like I said, patella for this view is at the top right. And then you also have that suprapatellar fat pad underneath there with your femur at the bottom and then your nice quad tendon at the top. This is a view starting in the transverse, so it kind of is a little bit messy. You can see right here in the middle is going to be your quad tendon, and then the little starry night like on either side is going to be your muscles. At the very bottom is your femur. And once you find it, you can just rotate that probe and then you'll move into your other view where you can see at the top your nice quad tendon and then go just a little bit further and see the patella there. For the patient positioning for the meniscus, your patient is also supine, but their knees flexed a little bit more to 90 degrees. So you can put their foot on the table. Their probe is placed longitudinal plane as well, lateral side of the knee. Should feel for the joint lines to be right along that joint line, kind of superior to your fibula. The main structures for this one is going to be your femur, is going to be a reflective structure, and then your meniscus should be a triangle-like hypoechoic structure inferior to the femur. So here it is at the left side of the screen is your femur, and then kind of in that gap, the hypoechoic area is your lateral meniscus, makes a little bit of a triangle there. And then on the right would be your tibia. So this is just a video of it going, the probe going right on the knee. Same view, so left is your femur and then right would be your tibia. So take home points would be when looking for the tendons, just be careful of angling the probe. Any angling of it can cause an appearance of tears in the tendons, just different views and stuff. And then the patient positioning makes finding these structures easier. So if your knee is flexed a little bit, for example, for the quad tendon, you can get to it a little bit easier. And same thing for your meniscus. If you bend your knee, it's opening up that joint line just a little bit. And then knowing your anatomy makes it easier to identify what structures you are looking for.